Okay, well, thank you very much for joining me today, you two. I'm really excited about this chat, and it's actually the first video I'm recording as part of our new Future of Dentistry campaign, where we'll be pushing out content over the course of a number of weeks about the future of dentistry, what this will look like, and what this will mean for the whole profession. Would you both like to start by just introducing yourselves, please?
Okay.
I'll let you go first,
So my name is Kat Edney. I'm a dental therapist and I work in private practice in London. And I also run hands-on courses for dental therapists. I've got this vision for dentistry where dental therapy is utilised in private practice a lot more than it is at the moment. And my goals are sort of focused in two areas. One is to get dental therapists really confident in providing dental therapy, and the other side is to get dental practices really confident in understanding the role of a dental therapist and how they can utilise them.
My name is Lauren Long. I am also a dental therapist. I work in private practice in Edinburgh. I've worked in the same practice for the last almost 11 years now, and I work to my full scope collaboratively with the dentists. We have a really cohesive team, and basically I've seen how dental therapy can work in practice. So as Kat said, also we're very much on the same page about this. I'm also very passionate about, having dentists, utilise therapists their full scope, realise, what it can bring to their practice, what it can bring to them personally, and also to helping dental therapists work to their full scope and achieve great working conditions where everyone is catering to their niche and working.
I think that kind of feeds in exactly to today's topic, which is obviously about utilising dental hygienists, dental therapists. And you've just both nailed it on the head, obviously, how that can help a practice run as smoothly and efficiently as possible. So, I know you two, we spoke about this just before we started the call, but you're quite a well-known team for this topic. Lauren, you said that you cover the northern area, and Kat, you're down in London, so you cover the south. So, why are you so passionate about this? Where did this come from?
I think for me, I've been qualified since 2008. I was really excited to get out into practice. I really loved therapy, and the reason that I went into training to be a dental therapist is because I love the artistry of dentistry, and the fact that you are an engineer, an artist, a healthcare provider. And so to get into practice, being super excited to be able to work to my full scope, and then be utterly and desperately let down that there just wasn't the opportunity for me to go and do that for years. It just built up in me that there's something not right. This is just not right. I was extremely fortunate that my training was paid for by bursary by the NHS, and even in the NHS, I wasn't finding any opportunity to work to scope. So, having developed my own thought process around the situation and developed my own understanding of how dental practices run, and looking at them as a business and seeing how inefficient most dental practices are, because they stick to this really basic sort of one-man band dental route. I just couldn't hold it in any longer, and I decided I'm going to have to be more vocal about why dental therapy needs to get put back into practice.
Okay. What about you, Lauren?
I had a very similar experience to Kat in that, went through uni, did our 3 years of training, and we trained alongside the dentists to have, exactly the same direct restorative skills as they did. Came out of uni, we're kind of, I think, we were prepped for the real world, but maybe we didn't quite know, not many people on my course anyway in my year had been dental nurses, and a lot of us had come straight from school, so we didn't really have much kind of real world experience. So we kind of thought, we're going to graduate as dental therapists, we're going to come out, there's going to be dental therapy jobs. And I will say that I think we are slightly better. I think we've spoken about this before, Kat. We're slightly better in Scotland, I think, at utilising dental therapists than potentially, down south in England, but still not great, still not as good as we would like it to be. I've talked before when I've spoken about utilising therapy about the traditional kind of, you come out you have all these therapy skills, but you're doing kind of, you know, set, rigid 30-minute hygiene visits. However, when I first graduated from uni, I was doing 15-minute NHS hygiene visits, and that's what my first job was. And I just came out, and similar to Kat, I just thought, this is not what they told us it was going to be like. You know, this is not what we trained for. I did that for a little while. I also worked down in England for a little while. I was like searching for this like elusive, like, perfect therapy job, you know, that didn't, you know, it didn't seem to exist. But then I moved back to Scotland. I joined the practice I'm in now, and we have a group of 13 practices now, all working to the same system where a lot of the restorative work is passed, so anything within our scope as therapists is passed to us, and the dentists basically all have their own, you know, special interests or their own niche that they can work towards. They can spend their, you know, they can have like a whole morning doing, you know, treatment for one patient of something that they love to do. They're not having to do, you know, the things that they consider maybe slightly boring compared to, you know, we love doing kind of the routine restorative stuff, and it just works brilliantly for everybody. So I think, you know, seeing how it works in real life really kind of spurred me on to kind of try and spread the word and say, you know, if you can accept, you know, listening to this and seeing what it can be, and trying it out even, you know, I know I've had therapists message me and they said, oh, you know, my practice principal is quite skeptical and, you know, doesn't know about really what a therapist can do. And sometimes that's half the battle, you know, sometimes, you know, there's a bit of mystery about what a dental therapist is, even within the profession. You know, patients definitely don't know, but even within the profession, there's sometimes, you know, a little bit of hesitancy and a little bit of knowledge that needs to be improved before we can be utilised effectively. You know, I've had people message me and said, you know, just ask them to give it a try for a few months and see how it goes. And barely anyone has gone back afterwards, you know, once they see how it can work.
I mean,
it stays.
You said that there's like a misunderstanding actually within the profession itself, which is obviously slightly alarming in 2023. But, you know, it's a journey. You're getting there, and you two are playing a big role in kind of spreading the word on how dental therapists can help. We use the phrase utilising dental therapists a lot. I mean, what do you actually mean by that? I mean, what does that involve? What work can you guys do?
Well, I think it's really important to not miss out as well utilising dental hygienists, because obviously in the profession we often lump together dental hygienists, dental therapists, and a lot of us are dually qualified. Like I'm dually qualified. I think, Lauren, you've got like two. Have you got one degree or two separate? Yeah. So I think to start with, a basic way of looking at it would be to look at a hygienist model, which is what Lauren touched on already. That your hygienist is able to do a huge variety of treatments for the patients. Yet quite often you'll go into a practice and they'll be doing 15, 20, half an hour, scale and polish, back to back, the same treatment modality for every single patient, the same fee for every single patient. And that's all they're really expected to do. No one really fully understands what that hygienist is capable of. And so you have this limited ability to create income in the practice or in that surgery, because there's nowhere for them to go. There's no sort of like charging more for the complex treatments that they can do, the periodontal treatment, or for fissure sealants that they can do. They can place rubber dam, they can do fluoride treatments. There's so much more that your hygienist can be doing that takes that away from the dentist having to do it, or takes it away from having to refer. That it's to me, it's crazy, even on that basic level, that we have these scale and polish models still knocking around. And I do think it's changing, but yeah, it's a huge waste of everyone's time. And a really lovely way to see it is, the new S3 guidance that came out for periodontal treatment really easily lays out for you exactly how that treatment should be done, and how it can benefit, the patient, but also the clinicians. Still we see this 15-minute, 20-minute scale and polish. I hope there's not that many 15 minutes out there anymore. That's changed quite a lot. And then when you look at a therapist, all you're adding to that therapist model is that they can then also additionally do restorations. So anything direct in the mouth, anything that doesn't involve the lab doing any of that work, is possible with your therapist. So if you're looking at a dentist and that dentist is doing checkups and that dentist is doing composites or amalgams, anything direct in the patient's mouth, realistically what they're doing is earning the low profit appointments when they should be spending their time doing higher profit appointments, the things that we can't do, which would be crowns.
Yeah, exactly.
Yeah, I think it's I don't really know how this came about, this whole kind of set time model. To me it's always been a bit confusing, because I feel dentists tend to have total clinical autonomy over their book. They can assess a patient and they can say, I want to see this patient for X amount of time for this treatment, and I think handing that autonomy over to the hygienist and the therapist, because they know what they're capable of, they know what they can offer to patients, and having this, like as Kat says, the BSP, the EFP perio guidelines really kind of feed into that model as well, because they really encourage us to be spending time with patients, to offer them these kind of steps of treatment to get them to health. And that's obviously that's always the aim, is to get our patients healthy. That's the main thing. We're not talking here a lot of kind of elective treatments and things like that. Even on a basic level, if you're just talking about health, it's it's having that time to spend with your patient, having a protocol. I know, Kat, you and myself are really passionate about protocols. It's having everyone in the practice singing from the same hymn sheet, and having, I can look at a patient and once I've assessed them, I'll know, what appointments I need and what length of time I want and things like that. And I just think it's good for us to have that, because I think, dentists aren't there with their kind of you must do everything in half an hour, or you must treat everyone the same, and it's exactly the same.
And nowadays, I think a lot more modern dentists are coming out of practice. So younger dentists now, they're coming out of university, coming into practice, and they've actually trained alongside therapists, whereas an awful lot of our more mature dentists who've been in practice for many years maybe didn't have dental therapy courses at their university when they were training, maybe weren't training alongside therapists. Also, there's been a historic sort of disdain for the profession from dentists, way back in 2002 when direct access started to be discussed. The BDA weren't massively keen on the idea of dental therapists working in practice at that time, and so I think there's been a lack of information. There's been a slight sort of separation of the two roles and the two professions, whereas the future is that dental therapists are training with dentists more and more. It's pretty much every university now has BDS colleagues and therapist colleagues working together, and I think an awful lot of the new practice owners that I'm speaking to, the younger practice owners, they are the reason, and they are the driving force, along with the therapists that want to do the work, to bring therapy back into practice, because they really see the benefit. And I can understand why colleagues who have been working in dental practice as this, like I say, one-man band model for years and years, head down, working hard, they feel that their model is working for them because they don't know any different. They haven't been able to look outside the box, and they haven't understood what a therapist can do. And I think, unfortunately, the only way we're going to facilitate change is for those colleagues to be educated by their younger colleagues who are coming out saying, hey, guys, this is working really well for us.
And that, I mean, just you saying that is a tough barrier to overcome. I mean, not just in dentistry, but across all professions, I think there is a real resistance to, like you said, maybe more senior colleagues taking advice from people who have just come out of educational university or training. And that I can imagine that is a tricky one. But it sounds like that it is getting better, that you are seeing improvement when compared to 2, 3, 4, even 5 years ago.
Incredibly. I feel, I don't know about you, Lauren, and obviously I've been travelling across the country now for a couple of years providing these hands-on courses for therapists, and at the start in London nobody was working as a therapist. They were all wanting to, they were really, really interested and really talented therapists, but no one with a real, what I would call a full scope therapy job.
Okay.
And as Lauren touched on before, in Scotland, when I came to Scotland, there were an awful lot more therapists, but slightly underutilised, but they were working at least holding a fast handpiece at least.
Cool.
But in more recent times, I'm seeing far more therapists. I'm getting calls from dental practice owners all over the country asking me how to implement this. There is much more of a buzz around dental therapy because I think people are really starting to understand that actually maybe what we were doing in the past wasn't right. And it's this mantra, isn't it, of, you know, if you stand still, you'll fall behind. So a lot of people are wanting to progress and to move forwards with how they run their dental practices.
So Lauren, do you think this is the future?
Yeah, absolutely. Like Kat, I've definitely seen a massive turn in the last few years. You know, there's been a lot of progression actually from, you know, I think it's the newer dentists that have trained with therapists that are driving it, but I think it's all about mindset, isn't it, Kat? You know, there are people from all, you know, kind of ages in the profession that, you know, if you're open to it, you know, I know practice principals that are maybe more mature and have wanted to learn, like they want to know what's going on, they want to stay on the pulse, you know, they want to be current, and are utilising dental therapists in their team, and I've really seen, you know, how it can benefit them. But yeah, I absolutely agree with everything that Kat just said. I think it is the future, and I think as well with, you know, there's been a lot of changes recently. I know we've not kind of touched on yet, but with the NHS in England are now allowing therapists to open a course of treatment, whereas traditionally the patient would have to come and see the dentist, and the only way for them to see a dental therapist or a dental hygienist can also open a course of treatment now as well. The only way before now was that they would have to come and see the dentist first for a checkup, then they would have to see the hygienist or the therapist via a referral route, whereas now we have more of a kind of direct access situation where it is still under the dentist performer number, but the therapist or the hygienist can carry out treatment on that patient directly now. So that is a big step forward, I feel, as well, and that has led to more, I know Kat, you've seen this as well because we've discussed this in the past, but, you know, more practice principals who are really exploring dental hygiene, dental therapy to see what they can, you know, how they can maximise the staff that they already have in their practice, who maybe haven't been working to their full scope. And we've had a lot of questions from therapists who maybe have not done any restorative work for a while. You know, they're now going to Kat's courses. We both teach on the Smile Dental Academy postgraduate diploma as well, and we have seen a lot of therapists coming along now saying, oh, I'm so happy because my practice principal finally gets what I've been saying and really wants to use me, and I really want to up my skills. And I think as a profession, you know, as, you know, nurses, technicians, hygienists, therapists, dentists, everyone in the profession, you know, I think we're all those type of people that always want to further ourselves. You know, we always want to learn, we always want to keep current, we always want to keep up with things. And I think, you know, hygienists and therapists, especially, you know, the past while, I've seen a massive influx of, you know, courses being launched specifically for hygienists and therapists, you know, restorative courses like Kat's directly for therapists, but also, you know, lots of companies that have previously run courses and maybe, you know, it's been quite restrictive, it's maybe only been for dentists in the past. They've now seen that, you know, we're really willing to learn. We want to, you know, we can do things to the same standard that a dentist can, and they see that we're willing to, you know, to build ourselves. And, you know, we always talk, Kat, about, you know, as a therapist or a hygienist, you know, we would always encourage people to build their own portfolio, you know, take photographs of your work, track your progression, you know, always try to, you know, get better and better as you go along. And then also for you're talking about, you know, how to kind of explain to practice principals, but I think, you know, the old cliche, like a picture paints 1,000 words. If you have pictures of your work and you have radiographs and you have all this evidence of what you can do, it's quite hard to say no then, you know, of the skills that we can offer. So I would suggest that people do that, you know, if they want to try and get into doing more of the work they want to do.
Well, thank you both very much for talking to me today about that. I think a lot of this will resonate, and a lot of this will also be convincing those who may not yet be convinced by how this can help both their business, but also just free up time for themselves if they're still practicing, and other dentists, and also help, you know, utilise and actually have their dental hygienists, dental therapists work and feel more fulfilled. Because I can imagine, you know, you don't want to be doing the same appointment over and over again. You want that variety. I feel that's another common theme in dentistry. You know, you say you want to progress, but I feel that all people always say that one of the things that attracted them to dentistry is that no day's the same, and you know, you don't want that.
No, you're absolutely right, and I think that you know, allowing everyone in the practice to really play to their strengths and what they love to do. So like Laura was saying, having, you know, your dentist with special interest being able to just do the work they love to do, and the same with the therapist, that more collaborative approach. Not only is that going to be effective for staff retention, which is a huge issue in dentistry at the moment, but also patient retention, because in this digital age where patients can find clinicians wherever they go, dental practices need to start looking at their model and make sure that patients feel comfortable seeing a multitude of different practitioners within their practice. So the patient is a patient of the practice, not a patient of a clinician, because when that person leaves or moves to another site, you lose an awful lot of your goodwill of your patients, because they can find their clinicians nowadays. It's things have changed. So that that collaborative approach has multiple different benefits for practice owners as well.
Thank you very much.